whatevs.
It's whatevs. Oh, man. Well, Lillian Posadas, hospital administrator. Hi, Lillian.
Hi.
Hi, good.
Good morning to you two. How you doing over there, sunshine?
I'm doing good. Thank you. Doing great.
You look
How are you all?
you look marvelous.
Thank you. It's the hair.
And things have slowed down quite
Right.
significantly
Yeah.
over at GMH. And
Yeah, yeah. And our census for a while we were at one. We were also at three and at four. This morning it's creeping up to five. We are at five this morning. Fortunately, none of them require ICU level of care. They are on a telemetry monitoring system. So, they are at that level of care where they need to be monitored with their heart condition, heart rate, heart rhythm. So they're closely monitored.
5. Is that from the weekend? Because I think there was several cases. Was it Saturday?
Right.
Saturday night or?
I think even Friday there were four positives that public health reported. And one of them was seen in the emergency room and admitted.
Mm-hmm.
And then a couple of others were seen again. Several others were seen. And there were some that were positive. One or two got admitted, needed to be admitted in the telemetry. So
Lillian,
we are at
we're at 5, right? So I know that we haven't got the variant test back from CDC, but I mean, just in kind of looking at the condition of these patients, is it anything different from the level of sickness that we saw in the second surge? I mean, I know it's nowhere near the numbers, but I'm just like, how sick are these patients who are getting admitted?
Well, some of them are still, with the respiratory conditions, their oxygen level, but it's not as bad to the point where they need to be on ventilator support. They are on, some of them are even just on room air. Some are on the high flow nasal cannula, oxygen. And so fortunately, and like I said again, we just pray hard that they don't get to the point where their respiratory symptoms will be compromised to the point where they will need ventilator support. So for now, they are pretty stable.
Mm-hmm. Earlier we played a clip of a press conference from 1 year ago, and you were there. Linda and Pinko DeNorsi was there. Tell us about, your reflections when you think back 1 year ago today. That press conference was held, and the governor had announced our first 3 positive cases of COVID.
Yes. Oh gosh, that was really quite a high anxiety level because there was so much uncertainty. We didn't really have much of any clinical or scientific data to go, to guide us with how we are to provide the care and how we are to deal with these individuals when they come into the hospital, other than just making sure that we wear the protective personal equipment and exercise as much as possible, whatever infection control precautions that we could. It was just a lot of anxiety and a lot of, concern and, worry for the people, for our our staff, the training that we needed to make sure we had in place, because we were all pretty much, it was kind of like in the dark, although, we just knew a little bit in terms of infection prevention, just wearing the mask, wearing the gloves, and just really all the PPE gear. And, at that time, we were still also not fully equipped with all the PPEs. We had some, but, we were concerned that we may not have enough for everybody. And at the same time, we were still struggling with space. Where are we going to continue? If the numbers continue to rise, where are we going to place these individuals and keep them contained? So there was a lot of, uncertainty, but we learned. We learned throughout the year how to handle these, and we learned throughout the year that, okay, we don't have to be so anxious. We got through this. Our staff, all the employees, all the doctors, everybody, even the guards and the housekeepers, they rose to the challenge, and they faced this, epic battle courageously. So just reflecting upon how our staff did, my hat's off to them. for their courage and their bravery to write this battle with us.
Well, I think you described it, the epic battle. It certainly was epic. What was it though for you throughout this past year? I think that really hit you hardest, that made your heart sink. Because there was quite a few moments for me here at KUAM. But for you, what was it, I guess, that hit you the hardest?
The hardest was when we lose the patient. We try so hard. Our doctors, our nurses, they did everything that they possibly could. But, when we lose that battle for that individual, we couldn't save that individual. That was really very painful, very difficult, and especially for the families. Really for them, because they're the ones left with the loss, with the grief of their loved one. Mm-hmm. And so that was really the hardest, was losing a life to this COVID.
Well, we're coming out, and I think even just with GMH, and we spoke with the Archbishop, because we lost Monsignor David Kitukwa. And for GMH, it also hit hard. I mean, you saw nurses that were infected with the virus, right. And then I believe there was a nurse that had passed away. So yeah, right. Definitely, everybody was affected by this. But one year later, now there's talks with the 661 million that the governor was pretty adamant. We are going to see a new hospital being built with $300 million. What are you hearing in terms of the discussions for this new hospital? What is the latest?
That we are going forward with that goal, and that the governor has informed us that of the $661 million that Guam will be receiving, 300 of that she will reserve that and earmark it for the building of the new hospital. But, realizing that it may not be sufficient, we're going to need to find, additional funding sources. So, we are meeting, if not this week, then next week, definitely, to continue the discussion with the task force. And, first we need to really come together and do a feasibility study, what this hospital is going to look like, what the bed capacity, how many beds, what kinds of services are we going to provide in this hospital, inpatient, outpatient, and also preparing for possibly another pandemic. We need to make sure we prepare for that. And so those are all some of the factors that we're going to be discussing, putting on the table, to conceptualize this hospital. And so the feasibility is very important to then help us determine, again, how this hospital is going to be, what it's going to look like. Not just for, in the 10 years, but, really looking ahead, planning ahead, anticipating what the changes are in terms of the healthcare system and the needs of our people of Guam.
If we were to open and say this new hospital is built, would it mean that the GMH would be closed?
We could close, definitely it will close and decommissioned as a hospital. Okay. Or someone else can, we can rent it, lease it, so they can generate some revenues for the government. Because it's still a usable facility, even though it may not necessarily be usable for another hospital, but it can still be used, for a different purpose.
Right, like rehab or something.
Right. Absolutely.
Lillian, we had Senator Moylan on earlier, and he was expressing just some concerns about the lack of details for any plan to build a new hospital. How far along are we? Because I know the governor has already, like you said on this show, committed half of that $661 million to go towards building a new hospital. But other than that, and I think the prospective land up there on Back Road, we don't really know much. About it.
Right, and I appreciate Senator Moylan's concerns and his comments, but really we still don't have details, full details. It's all again in discussion. It's all in conceptual, discussion. And so the task force will be putting together. It's going to be an evolving document. With the details that we may put some details in it, but then we may change it because depending on the feasibility study. So we don't have, really specifics yet other than the amount that the governor has earmarked and other than the land, the estate that the governor is looking for us to build this facility. And so those are as much of a detail that we have. We don't even know how much it's going to cost. We don't know how many beds this hospital is going to be, what kinds of services we're going to provide. So those are all going to be evolving as the task force comes together and the feasibility study comes together. So we'll get more details as it develops.
Okay.
And just you mentioned, because we talked about the 300 million and more money is going to be needed. Exactly, because we keep hearing different numbers. How much is it going to cost for a new hospital total?
Well, based on what we've done some research, some hospitals, and depending on the size, depending on the types of services, it can range up to 500 million, 700 million. What the Army Corps of Engineers, when they did the assessment 2 years ago, to replace a new hospital was going to be somewhere around $463 million versus retrofitting it, fixing it, it was going to cost more. So those are the ballpark figures that we're getting. But then again, by the time we put together this conceptual, design, how healthcare costs keep rising, medical equipment keeps rising, and so it could change.
Right. Okay. The last time we spoke with you, we were talking about changes to the visitation policy or proposed changes. Is there any update on that?
The policy right now, in fact, actually the draft is on my desk right now reviewing it. But the one change that we added was the factor that, patients who are 75 years and older, we're definitely going to allow a family member to be with that patient in the hospital, just so that, the individual, whatever anxieties they have, whatever fears, they have a family support right in the room all the time. So that's what we're looking at. And we're looking at different levels of, again, the visitation. So it's a document that hopefully I can finalize and sign today.
Okay, so it could effective tomorrow, maybe, after you sign it?
Yeah, it could.
Okay.
Absolutely.
Okay.
Could be. Yes.
Anything new with the payments to the traveling nurses that were behind? I think we talked.
Well, we had good news last week that the FEMA pretty much is going to obligate and transfer the money. And it possibly may have happened already. I need to verify that because I think it may already have been obligated to the Department of Administration accounts.
Awesome. So then we would be squared away with that. Okay.
Right. We can then pay the travel company.
Mm-hmm. The other thing during the State of the Island address that the governor talked about was how you're going to be focusing in on recreditation for GMH. Tell us the steps you're going to be taking for us to get back on track.
It's a major project, and so already our regulatory compliance administrator, she and her team are working together to design the roadmap of how we're going to achieve that accreditation and which accrediting organization, because it's not necessarily just the Joint Commission. There are other accrediting organizations, and so we're going to be reviewing and comparing which one will be the most cost beneficial for GMH for Guam. Because the Joint Commission accrediting organization, they're quite pricey. They charge a lot of money. And so we're going to try and see which accrediting organization is also at the level of the CMN standards of conditions of participation, that then we can, really be synchronized with meeting those standards and meeting those accreditation regulations. So we are already pretty much, launching it. The regulatory compliance office team are already designing the roadmap towards getting that accreditation.
So is it easier to get accredited with the other guys than it is with, or is it all the same? Is it just a matter of cost?
That's what we're comparing. We're comparing, which one will meet our needs, and at the same time, which one are more doable, more realistic, more practical, that are also in line with the CMS conditional participation.
But how long have we been going with the JCO accreditation organization?
Well, we lost accreditation in 2018.
Right.
Then COVID hit, and so we had to put that aside and just focus on the COVID response. And so now, with the Joint Commission accreditation, you have to have some record of a year collecting all that record, so that when they come to review, we can show that we've been doing this for a year. So we need to have that. But we'll see how the other accrediting organizations, what their requirements are, whether it has to be documents from a year ago, because with COVID, things were very different.
What happened to the documents?
Yeah.
Well, again, there are many different elements in the Joint Commission that you have to accrue: the documentation, training, the leadership. All the meetings have to be then documented. All those elements, such as the environment, all of that in track. And so when we were with COVID, we were changing a lot of things to accommodate and open up rooms. And so we have that, we have the documentation, of that. So, but we're not sure if really that is what going to be the focus of the accreditation, which is basically not. It looks at a lot at the leadership. It looks a lot of the safety, patient safety, the quality, the environment, many different elements, of the standards of care under the Joint Commission.
But the whatever new accreditation body we're going with, is it still going to be like the U.S. standards, or are we trying to get a third world accreditation?
Well, there's international accrediting organization, and there's also global. There's a global accrediting organization, and so those are the different organizations that we are going to be comparing.
Okay, so we're not necessarily bound that because we're a territory we got to get like the U.S. accreditation.
No, not necessarily. I mean, we'd like to stay within the U.S., absolutely, definitely. But, if there is an international accrediting organization that is not so expensive as the Joint Commission, or that, their standards are pretty much really aligned with CMS, so those are what we're going to be looking at in terms of criteria to decide and determine which.
It's kind of crazy that we're talking about cost as an issue when we're getting $661 million.
Okay, but then that $661 is for the whole island of Guam, and so there are other areas that need the funding. So at least half of that, the $300 million, is going to be then the seed money for the new hospital. So which is great.
Right. Just to unpack this, Lillian, so basically we're not going to go with JCO anymore because there's certain requirements that they have in terms of documentation and costs relative to attaining accreditation. So now now we're going to go with another group. We're going to go with another group that hopefully... A correction. I didn't say we're not going to go with the Joint Commission. Joint Commission is not the only accrediting organization. We're going to compare that with other accrediting organizations. Okay. Which one would be really the best for Guam, for GMH?
Which is lesser costs and faster to reaccreditation?
Cost is a factor that we're going to, put into the criteria in terms of determining which one will be the best.
But so
definitely.
So the Joint Commission, the organization that we have been, GMH has been going with, right, Have we ever deviated from this joint commission? Have we hired any other companies in the past to do accreditation? Has it always
No,
been Jayco?
it's always been joint, yeah, the joint commission. It's always been the joint commission, and maybe back then that was the choice. That was by the leaders back then. Now that we are very much aware of different accrediting organizations, we want to also take a look at those.
Okay.
Okay.
Anything new with the skilled nursing facility?
We're going to be moving the residents back to that facility, so we're getting it prepped up. We're going to, use it for what it was originally intended as a long-term care facility, and so that's our direction now, is to move the SNU residents back to their original site.
When are they moving back?
Well, we're still preparing it, and we also need to inform the residents and their families and the resident council ombudsman. We need to make sure we communicate all this to them.
Like this week there is the move? Or?
This month.
This month.
Definitely this.
Okay.
Yes.
And what about the designs? I think we were talking about, because we were going to prepare it for use in the future if need be as an alternate care facility, and FEMA, I believe, provided money for
and
the
we're still moving in that direction as well, getting it prepared so that it can be switch ready. If in the event we have another surge or another pandemic, that facility is the alternate care facility. That will be then a isolation facility. Yes, we're still moving that path. But in the meantime, we're using it also for the long-term care facility for these SNU residents. Yes.
But in terms of any contracts or anything that were signed to